Hello, I'm Dr. John Kelso. I'm an allergist at Scripps Clinic in San Diego, California, and I'm going to take a couple of minutes to talk about something called oral allergy syndrome, or what perhaps is more properly called pollen food allergy syndrome. So if we back up a little bit and just talk about allergy in general, I think it's important to remind ourselves that no one is born allergic to anything. Some people are born with a tendency to become allergic to things to which they are exposed. And if you have that tendency to become allergic to things, one of the things you can become allergic to are airborne substances like pollen from grass and trees and weeds. And when you become allergic to something, what that means is you make a certain kind of allergic antibodies called IgE antibodies that are directed against whatever substance you may be allergic to, in this case, pollen. Now, most people who are allergic to pollen and who have what is called allergic rhinitis, or more commonly called hay fever or seasonal allergies, most of those patients would have typical nose and eye symptoms when they're exposed to the pollen to which they're allergic. So red, itchy, watery eyes, runny nose, stuffy nose, itchy nose, sneezing, etc. So there's a subgroup of patients who have this hay fever type allergy, the nose and eye symptoms when they're exposed to the pollen, who also say that if they eat certain fresh fruits or vegetables, that they get itching in their mouth and occasionally other symptoms. And it turns out that those two things, the nose and eye symptoms from the pollen allergy and the itchy mouth from eating the fresh fruits or vegetables, are actually related, and that's what's thought of as oral allergy syndrome, because the symptoms usually affect just the mouth. And again, I said the other name for this is pollen food allergy syndrome, which again stresses the relationship. So it turns out that there are some substances in pollen. So if somebody has made these allergic IgE antibodies to the grass or tree or weed pollen, there are some substances present in the pollen that are also present in those foods, even though they're not botanically related. There are some of these associations that are stronger than others. So for example, patients who are allergic to ragweed pollen, which would be quite common, will sometimes find that they get this itchy mouth if they eat melons, such as watermelon or cantaloupe or bananas. And there are other associations between particular pollens and particular foods. Some, for example, where patients would have symptoms if they ate raw carrots or raw celery. The particular proteins that are responsible for this association, the association between having the hay fever symptoms and the itchy mouth when you eat the foods, those proteins are very labile. In other words, they're very easily broken down. And so unlike other food allergy, where we would be concerned that the protein in the food that a patient was allergic to would get into their bloodstream and cause more severe symptoms, such as anaphylaxis, that virtually never happens with this oral allergy syndrome because these proteins are very easily broken down. So if the patient takes a bite of an apple or eats a raw carrot or some watermelon and starts to get an itchy mouth, the protein breaks down before it has a chance to get into their bloodstream and cause more significant symptoms. And that's important because in cases of other food allergies, such as patients being allergic to peanuts or shrimp, we would tell the patient to strictly avoid eating the food because they're allergic to it. It could have a severe systemic allergic reaction. In the case of this oral allergy syndrome or pollen food allergy syndrome, we usually tell patients that if their only symptoms are itchy mouth, that it's actually okay to go ahead and eat those foods because we know that in the vast majority of cases it's not going to progress to a more severe reaction. So the other thing that has to do that patients can often confirm with these proteins being very labile is that the patients will say that if it's only with the fresh fruits or vegetables that it happens and not if they're cooked. So patients who would eat an apple and get an itchy mouth can eat apple pie and notice that it does not happen. Or raw carrots will cause an itchy mouth, but cooked carrots would not. So that's, again, this idea that the protein is being broken down by the heat. So there are rarely patients who have this where it's not fresh fruits and vegetables, but sometimes nuts, such as peanuts or tree nuts. And since those are foods that can also cause more severe allergic reactions, we're a little more careful about telling patients that it's okay for them to eat those foods. But occasionally, if we can really feel comfortable that it is this pollen food allergy syndrome, sometimes patients can even eat those foods safely. So if you're a person who has what you think of as hay fever or seasonal allergies, and notice that if you eat certain foods, you get an itchy mouth, you can now know that those two things are related, that the allergic antibodies you made to the pollen also cross-react with some substances that are in the foods that you're eating, and that in most cases, while that may seem concerning in terms of food allergy, particularly when it relates to fresh fruits and vegetables, if the only symptoms are an itchy mouth, that it's actually okay to go ahead and continue to enjoy eating those foods if the only symptom is the itchy mouth. So I hope that gives you a little better understanding of this phenomenon that we call oral allergy syndrome. And for more information about this or any other allergy topic, you can go to the website of the American Academy of Allergy, Asthma, and Immunology, the AAAAI website, for additional information. Thank you.